Good evening, y'all. So we're going to be starting on health promotion and care of the older adults in the integumentary system. So for the lesson objectives today, we're going to be going over and categorizing changes age makes to the integumentary system. We're going to be analyzing integumentary changes to create nursing interventions. We are going to be appraising patients for common age-related integumentary changes. We are going to be identifying ways to prevent common age-related integumentary changes, or issues actually. We're going to interpret integumentary changes in older adults, and we're going to rank the likelihood for your patient to develop integumentary issues. So on that, like whenever y'all been in clinicals, have y'all seen the Braden risk scale?
The what?
The Braden risk scale?
Oh, yeah.
Okay, so you know that right there is assessing to see the likelihood of skin breakdown. So that right there is kind of something we'll be talking about. So, how did this thing go backwards? All right, so the aging body. What have y'all seen with some issues or changes y'all seen with y'all's patients? Thin skin. So, anything else? Muscle weakness, dry. Yeah. Have y'all seen any like mental issues with them? All right. What's some common mental issues y'all seen?
Cotton.
What?
Cotton.
Cognitive is what you're saying?
Yeah.
Okay. Yeah. There's okay. Yes. There's some cognitive issues. Another thing you've got to think about is y'all guys are in the nursing home, right?
Yes.
Okay, have y'all seen some like acting depressed and stuff like that?
Depressed.
Yeah, it's like there's social changes that they're going through. So some of them are used to being at home, they're used to being with family, they're used to just being more active. I mean, some of these people, they went from being able to walk around by themselves, being able to feed themselves. Some people are developing incontinence issues. So it's like, have y'all seen some of them maybe a newer admit? Or any of them newer, or has most of them been there a little while? Skills? Okay.
Some of them been there from anywhere from a few days to I think a couple of years, if I'm not mistaken.
Yeah, I mean, I work in the long-term care. We have people I know been there at least 8 years, is I think the longest one. It's like, what have y'all seen with the newer admits that you would probably don't see in the older people, other people that's been there longer?
Some of them are still some of them are kind of trying to get into like a routine, and since it's kind of sporadic still, because the doctors and nurses and stuff are still trying to figure everything out. It's kind of chaotic for them, even though they or are oriented town sports still kind of puts them.
Yeah, it's a new environment.
She was kind of disoriented, and so she thought she was at the other place, and she was saying, this isn't my room.
Yeah, I mean, you do deal with a lot of dementia, Alzheimer's, in the long-term care units. So that right there is something that is a huge issue whenever you're first looking into aging, because again, environmental changes, cognitive changes, just any changes going on. It's like y'all guys were dealing with wounds, right? Okay. Did y'all see how some of those wounds have just been get worse than better? Well, they have you have delayed wound healing in aging bodies. So, and like you said, brittle skin. That right there is going to lead to skin tears and everything. So, like I said, we're just going to be focusing today on the aging body and the integumentary system. So have y'all guys been over the integumentary system at all yet? Okay, so we're just going to do like a quick little bit of information. So the function of the integumentary system, do y'all know what that is? Just like the function.
Oh, yeah.
First line of defense, yeah. So it's going to be protection. Like I said, the skin tears that you get from older brittle skin, it's like their protection isn't as well. Vitamin D absorption. It's like we're needing that for your body to function, right? And then temperature regulation. So whenever you're sitting there and thinking about it, what do you do whenever you're cold? Yeah, it's like you're gonna shiver. All right. Well, what are you gonna do whenever you're outside on a hot day? Sweat. So that is the function. That is part of the functioning of your integumentary system. So let's see. Then there's also the structures of the skin. So have y'all seen TB shots be given? Okay, so the epidermis layer right here, it doesn't have any blood vessels or anything like that in it. It's just normally, like I said, with skin tears, that's the first thing that's going to rip is your epidermis layer. Then you've got your dermis here. The dermis has blood vessels, it has hair follicles, and it's got your nerve endings. What could y'all think with like an aging body that this layer right here would have some issues with? It's going to have some issues with your vessels. You've got people who have like diabetes, and they're going to have the blood vessels are going to be messing up, their circulation's going to be messing up, you're going to have their nerves messing up. And that right there, just this layer right here, is going to have some issues. And then you've got your subcutaneous layer right here. So subcutaneous is your fat layer. So with some of your elderly, you're having the fat layer being decreased. And that's actually how we get our wrinkles. So yes, worst part, everyone hates it, right? It's like everyone's trying to figure out how to fix it, but considering this layer right here, there's not really much we can do. Okay, so you got your pseudoferous glands. Your pseudoferous glands. I guess y'all guys haven't been through it, so this right here is your sweat glands. It is what is going to make you sweat. So then you have your seminous glands. So this is actually the part that's inside your ear or inside your ears. So that's where whenever you're trying to clean the inside of your ears and you got that yellow junk, that is actually what that gland right there is producing. Then you have your sebaceous glands and your hair and nails. Okay, whenever you're looking at your patients, have you noticed how their hair and nails look? Okay, so have you noticed how there's uneven distribution of hair, how the nails are brittle? Well, that right there is some of the issues that we're going to be discussing with the integumentary system of the older adult. So, age-related system changes. Y'all guys have said the dryness, thinness, hair thinning, brittle nails, delayed wound healing. Can y'all think of anything else that it might cause? No? Okay, that's fine. What about this touch sensation? This touch sensation right here, like I described earlier, their nerve endings are a little bit less, especially if you have someone with diabetes. And you're losing layers of skin with this loss of fat, so that's also going to affect the touch sensations. Whenever you look, have you seen the lentigo on people? Or yeah, those little age spots. So just those right here are going to be issues. So whenever you're also, I mean, as you can see right here, it's like this right here is as they lose fats, the wrinkles being produced, and all those little issues. So let's see. And then, like I said earlier, delayed wound healing. Have you seen any of them have infections in the wounds that they have? Or most of them being treated pretty well?
I think one had a little bit of an infection, but they were in the midst of still wrapping it up, trying to get it to heal.
Okay.
I don't think it was massive though.
All right. And I mean, that's perfectly fine. But one of the issues that you do have with age-related changes in the integumentary system is delayed wound care and wound healing, and then that right there causes an increase in infections. So in y'all's book, I went to table 33.3. So these are like some psychological changes that are going on in the integumentary system. So the sebaceous glands, like I mentioned earlier, those right there are going to cause your skin to be dried out. Your subcutaneous fat, like I said, wrinkles, the decrease in the thickness of that epidermis is going to lead them to susceptibility to trauma or skin tears. The melanin production that comes from the decrease in vitamin D absorption, that's going to cause the graying of the hair. And just like the peripheral circulation issues will cause your nails to thicken, cause yellowing. Um, it's like, and just there's so many issues that can be caused by your integumentary system with aging there. All right, so whenever you're doing an assessment of the integumentary system, have you seen any of them of your patients have hydration issues?
Some of them.
Yeah, you see those dry mucous membranes. Have y'all had where you like pinch the skin and it just stays tinted? Yeah, so that's one of those things. It's like whenever you're assessing, if you pinch the skin here or pinch the skin here, sometimes it'll be stay raised because they are so dehydrated. Um, that thin skin, like it's been said, the skin tears. Have y'all seen any of them have skin tears? Yeah, it's like it's just a little bit flat skin, ain't it? Yeah, and it's so easy. It's like whenever you think about a wound, it's like you're thinking something cutting you. It's like they could just hit it on a door. Um, I mean, I think the easiest one I've ever seen is they sit there and they had their shoe and they hit their shoe and it just tore open their hands. You gotta also think a lot of these people are also on like blood thinners, so they're also going to be getting the bruising easier. But that right there is also going to make the skin tears worse. The lesions on the skin, it's like it's so easy for them to get the pressure ulcers. I know earlier y'all guys were talking about pressure ulcers. Um, it's like, do you know how those come about?
Sitting on the
Mm.
bony versus
Yeah, and it's like all those little bony landmarks on the skin. Mm-hmm. And I mean, even the ones that you would think that are bigger and have enough, it's like their bodies just can't deal with it. So you also will be assessing hair because sometimes, like whenever you're looking into circulation, sometimes you have hairless areas on the skin because of circulation issues. You're going to be looking at nails because again, it's so easy for them to. It's like the nails are brittle, and again, they have such an easy attempt to have skin tears. It's like these you get a little bitty chip in your nail, and just suddenly they have a lot of places on the skin. All right, let me see if I can get. It's like this is just a quick video on skin assessments.
Now, when you're doing a head-to-toe assessment, one of the most daunting components is the integumentary or the skin assessment. Here's the reality. You have to assess every inch of your patient's skin. You just have to. Now, usually, we'll assess skin throughout our head-to-toe as we do other assessments on other parts of the body. But for the sake of this video, let's walk you through a specific integumentary assessment. First, you always make sure that you're explaining what you're going to be doing to your patient. The last thing you want is to start lifting their gown without their permission. So start at the head and the face and work your way down. You're looking at the skin's color. Does it match their ethnicity? Are there any pigmentation changes? Do you notice any cyanosis, jaundice, or redness? Are there any wounds, lesions? Is it moist or dry? When you get to the patient's shoulders and chest, make sure that you pinch the skin over their clavicle to check turgor. You should see it rebound quickly. If you see it tenting, it might mean they're dehydrated. Then you can do their upper extremities. Again, looking for color, moisture, wounds or lesions, edema. Make sure you're feeling the temperature of them. Are they hot or cold? Are they the same on both sides? Look at their elbows and their bony prominences and other pressure areas. Again, you always want to assess on both sides compared side to side. If one arm is colder than the other, there might be the vascular issues. So then you can lift your patient's gown and start assessing their abdomen. Look for scars from previous surgeries, any swelling. You want to make note of things like freckles or moles. Then you can continue down and assess the patient's legs and lower extremities, looking for the same things: color, temperature, moisture. You also want to make note of hair growth. Is there hair where there should be hair? If you see dark discoloration and absence of hair growth in the lower extremities, that could mean they've got some venous insufficiency, especially if they're also cold. And of course, if you see any edema, make sure you're checking for pitting by pressing your finger into the swelling. You also want to make sure that you look at their fingernails and their toenails. What color are they? Are they shaped differently, like clubbed or spoon-like? And remember, to look at their toenails, you have to remove their stump. So once you've gone head to toe on the front, you have to turn them over and look at their back. This part gets missed so much. Work head to toe again, paying close attention to pressure areas like the back of the head, shoulder blades, sacrum, and hips. Pressure ulcers can develop super quickly, so make sure you're paying attention. If at any point you find any lesions or wounds, make sure you get more detailed information like size, shape, color, drainage, and ask the patient how long it's been there and if it's painful. Now, once you've finished your skin assessment, make sure you're documenting any abnormal findings. Dress any wounds as appropriate and make sure that the patient is comfortable. So make sure that you also check out the outline attached to this lesson for more details on abnormal findings and what those might mean, and for a list of what to assess in the integumentary system. Now go out and be your best selves today, guys, and as always, happy nursing.
Alright, so do y'all know what the most common concerns are with the aging body? So you've got pruritus, you've got moles, you've got nail abnormalities, and you've got pressure injuries. How many of these have y'all seen?
All of them.
All of them? Yes. More likely than not, you're going to see all of them, and a lot of the times you're going to see it on every patient. Alright, so with pruritus, this is just the dryness of the skin, the itching. Have you seen?
There you go.
And that's why I've turned the mouse off earlier. Okay, so it's like how often do you see them giving baths in the nursing home?
Not that often. Not as often as we get.
Okay, but do y'all know the reasoning behind it?
Yeah.
It's like it's because of this pruritus, right? Because if you bathe their skin every day, you're getting rid of that natural oil on the skin. Where we're making it where they are having dryness. They are more likely than not going to be itching. And like we said, it's so easy for them to have skin tears. So if you get dry, itching skin, they're going to end up with marks just looking like they're being hurt, aren't they? If you do that. So as nursing interventions go, bathe them less often. But another thing is you're not going to want to use alcohol-based lotions. Y'all know why that is? Dries your skins. So whenever you are having to put lotion on them, you need to make sure that you are using the right type of lotion, right? All right. So do you know? It's like whenever you do it as well, you need to especially do it after a bath, because remember, you just took all the oil, all the natural oil off their skin, right? So another thing that you got to think about is they are susceptible to infection. So be careful about putting lotion between like little crevices. So like on the feet, you're gonna leave them like especially a diabetic. you're going to leave them open for infection, like infection between their toes, if you put it between that. So uh, if you let right here get oily, or start rubbing, that right there is a place that you need to focus on having lotion, because you're going to end up with like a fungal infection there, and then they're going to have rashes break out, right? So that right there is something else you need to focus on. All right, so moles. Y'all see a lot of places on your resident skins, right? So you got to think, when you're looking at moles, are they going to be benign? Are they precancerous, carcinomas, squamous cell, melanomas? So anytime you see something raised, discolored, just anything that would seem out of the ordinary, or most nursing homes, you're doing checks on their skin weekly. You should really be doing daily skin checks for wounds, but you also should be monitoring moles. So, like I've got a mole right here. It's raised. Yeah, I've had it forever though, and it's not changed. But if you had one that became like went from this color right here to say this color right here, it's like that's going to be an issue. If you had it go from this right here to suddenly like this, again, you have an issue. So whenever you're looking at your patients, you're needing to be measuring these moles. You're needing to see if there's any raised, if there's any indent, if there's any redness, if there's anything that could be an issue, and you're needing to use it. And most of the time, you're needing to document it on any type of assessment so that you know that nothing's changing. All right, so have y'all really looked at any of y'all's patients' nails? Okay, what's something that y'all have seen often on the nails? Yellow, yeah, yellowing's pretty off. It's something that you'll see a lot. Anything else?
A lot of them were, I guess, would be splintering.
Mm-hmm.
They almost look like a yellow, almost kind of like a bark.
Yeah. Mm-hmm. So I mean, yeah, yellow, splintering, the brittle. It's like they are so easy to break. It's like, and that honestly is a little surprising sometimes whenever because sometimes when you look at some of these patients' nails, their nails are thick, or they look like they're thick, but they're still brittle. They're still very easy to break. Have y'all seen any like clubbing? Have y'all had any patients that have COPD?
Mm-hmm.
Okay, so look at their nails next time you're there. A lot of the times, whenever you have patients that have prolonged COPD, you get this little clubbing like look to the nail. And again, it's like this right here. Anyone that has any breathing issues, it's a possibility, because that right there is your one of your most common indicators of a long-term breathing issue.
Is that why they always put the pulse ox on the finger?
Well, I mean, the pulse ox on the finger is it's one of the easiest places for us to reach. It's one of the easiest places to keep it in place. It's like, because I mean, you can put pulse ox on like the ear.
Yeah.
But have you tried to keep that in place?
Mm-hmm.
Yeah, so I mean, I've tried it a few times. It's like I don't want to do it if I can help it. So, it's like, have y'all seen nails have like pitting in it?
What's that?
It's just whenever you get like little grooves in your nail.
Oh, yeah.
Yes. Okay, let's see. It's like I keep forgetting I keep turning this thing off. All right, so pressure injuries. It's like, what stages of pressure injuries have y'all seen? Okay. So, did you get to actually look at it?
Yeah.
Okay. What all could you see whenever you looked at it?
Well, you see the fat and bone.
Mm-hmm.
And all the way up to stage 1.
Yeah. So, it's weird being able to see bone, ain't it?
Is it weird?
Mm-hmm.
Exciting.
Exciting? Okay. You're probably gonna be a wound nurse, aren't you?
Oh, what that?
A wound nurse.
No.
Really? I mean, because I don't describe seeing bone as exciting. So
Interesting.
interesting. Okay, yeah. You're everything's interesting whenever you're in school. So yeah, okay. So the epidermis. Have y'all seen stage ones at all? All right. What have y'all seen whenever y'all are looking at those? Looks like a bruise. Yeah. Okay. You know what makes it different
From,
from a bruise?
oh, it's not.
It's it's not broken, so that's how you know it's a stage one. But it's also non-blanching. Yes. So if you press on something and it doesn't blanch, then more likely than not, you're getting the start of a pressure wound. All right. So, and like I was telling you earlier about the epidermis, it's like it is only at that level. It's like when it opens up, you're now at the dermis level. So, have y'all seen the stage two and have y'all seen a stage two and a stage three at all? To know a difference on a picture? Okay, yeah. I mean, most of the time you don't really see them in person a lot. Even though it's so common of an issue, especially in the hospital, because even though you're supposed to be turning and repositioning these people every 2 hours, it's like a lot of times it don't happen. Um, Another thing you have to think about with your elderly is they have incontinence issues. So whenever you have your urine down there, it puts you at more of a risk to develop something. Um, but yeah, just with this right here, you're seeing just these two right here. This right here is where you get to the stage three is where you get to the fat layer. So again, stage two and stage three are kind of hard to differentiate whenever you're looking. But whenever you're looking at pressure wounds, the one thing you have to know is you can always go this way, but whenever you're staging a wound, it cannot go this way. So most of the time, even if it might be a stage three, there's a very good chance they're going to, if they are not sure, they're going to stage it as a lesser stage so that they can go further if it gets worse instead of something seeming, or I said that weird, I think, but just they are going to, you're wanting it to get better. You're not wanting it to get worse. So whenever you're looking at the way they're going to stage it, is they are going to stage it. I said it wrong the first time. They are going to stage it worse so that it can get better, even though they can't stage anything at a lower number. Whatever you start at is always going to be where it stays considered as a stage.
Okay. So, say for instance, I had a stage three, and 3 weeks from now, it only shows the dermis, the dermis and the epidermis. So it would just say her stage three is progressing.
It would be
It don't
improving,
say-
yes.
Okay, it will never say stage three is now stage one.
Yes. It will
Okay.
never, like I
Okay.
said, it will never go this way
Uh-huh.
whenever you're charting it. It's
Okay.
just, it is improving.
Okay.
You're seeing less. You're seeing, like with this right here, you're seeing blood flow.
Mhm.
It's like you're wanting to start seeing the blood flowing into that area again. Because a lot of the times, the deeper the wound gets, the worse your circulation in that area is. So another thing that you have to think, especially with the elderly and pressure injuries, is shearing or friction. So have y'all seen shearing or friction at all, like wounds? Okay, so these wounds right here are again, they have fragile skin. So when you're sitting there moving them in the bed, it's like if you move them wrong, it'll like the skin will get bunched up, and their skin will tear whenever you move them in the bed. Or it's like if you just push them kind of a little bit, like whenever you're trying to turn them, it's like, again, you'll end up with a wound there because there's friction. And just whenever you're looking at all of it, it's easy to do.
I know last week we came across two patients who have hyperpigmentation in their, well, most of part of their body and stuff. And while it's changing his brief, he kept telling us, well, I'm tender, right on his like sacral area. And we were like, okay, well, we reported it to the nurse. She came in, but it was very hard for her to even be able to tell if there was any kind of like swelling. Of course, it was a little warm because he had been laying on that area, so she kind of couldn't differentiate between like if there was becoming one or what was going on. So the wound nurse eventually just said that with hyperpigmentation, it's kind of hard to diagnose to see, what kind of pressure injury, if any, until it just starts to get really bad.
Yeah, I mean, there's some people's skin that it's hard to tell.
So would it be a pressure area?
Yeah, I mean,
or is it?
as I say,
Stage 5.
okay, so you don't really have a stage
Well,
5.
I'm just saying, like, it's another stage after stage 4.
Unstable. Yes.
I think what she was saying is that they weren't sure because it's so hard to tell, but it could be
something.
It could be red, but they weren't sure because of the hyperpigmentation, right? So they weren't.
They couldn't tell from discoloration or the heat because he had already been laying there.
She was basically saying we're gonna have to watch it and see.
Well, I mean, you also have the ones where it looks like it might be worse whenever if it is going to break open, but you actually can't see the wound yet.
Yes.
It's like because you have it in the lower levels, it's already started, but it hasn't broken open. So those right there are the ones that are the fun surprises when they finally break open. It's like they're not the ones you like at all. All right, so as nursing interventions go, like I said, we're going to be turning and repositioning them every hour or every 2 hours. You're going to be doing incontinence care. But here's the thing. How often do you do incontinence care, y'all?
It depends on how many patients you have, but I would try, or depending on how wet they are. I mean, if they get a bag of.
Well, I mean, here's one thing. What's their cognitive level? If they are able to tell you that they've went, it's not something you have to worry about as much because they are going to press that call light and you're going to be able to go in and change them. But your Alzheimer's and dementia person who can't even tell you their name, it's like you're going to be checking them at least every 2 hours and you're going to change them whenever they're wet. And cushioning boning provinces. So you've seen how they put pillows behind the backs to try to raise the scapulas off and try to raise the hips off the bed. Have you seen the cushions in the chairs?
Yep.
Okay. It's like those right there are very important. I actually have had a patient who they came into the building with a stage 4 pressure wound from sitting in their chair. It's like they did not have any cushioning in the chair. It's like they were a paraplegic. They could not feel the wound. It's like so there was no feeling there, and because there was no feeling there, they it just got worse. It's like even though they had family, it's like they just told their family they were fine because they couldn't feel it. But yes, this person ended up having to have a catheter put in and having to have a colostomy to even try to start healing this wound. So, I mean, it can get really bad on stuff like that. So, again, you just have to know your patient to know exactly what you're needing to do with each one of these things. And also, make sure there's cushion on something, on any prominences like that. Okay, so with the friction, we do not move across rough surfaces. It's like also, some of these patients, they eat in their bed. Make sure there ain't a random chip in there. Y'all think I'm joking? I have found entire it looked like they just dumped the entire bag into their bed because they couldn't keep it. It's like, or like half of their meal, it's like goes in their bed sometimes. It's like, and you'll end up with wounds like that. Yes, I mean, yeah, I mean, I'm actually, well, I mean, here's the most random thing I found in the bed, and it's like I had to write someone up for this. I found a bag of wipes in the bed behind the patient's back.
Like when you're working on in telemetry, those cords they be laying on.
It's like it's so easy though to not really notice that stuff, or I mean, even sometimes just the wrinkles of the bed make issues. All right, and again, these are people with thin skin, so you're gonna handle them gently. It's like, I mean, sometimes you feel like you can't, but you're always gonna handle them gently. I mean, there's some of them that are going to be a little bit where, I mean, I've had patients, they're 400 pounds. They're 70 years old, but they're 400 pounds, and you have to be careful with their moving. But sometimes, you know what I mean? It's kind of hard to be a little bit careful because you are trying to move so much weight. But that's also when you get 4 people in that room and have 3 of you holding them up while the other person's, you know what I mean? It's like you don't try to do two people. Do not use tape if possible. It's like, think about it. If they can just bump their hand against the door, what do you think tape's going to do to them? Yes. So.
She had blood drawn in both of her arms, and then the tape was, there was like 3 different small pieces on top, and then there was one wrapped completely around her arm, and her arm was no bigger than that.
Yeah, that's a little excessive.
Miss Quinley had to, she's like, just watch this. And the second arm, I actually ended up having to use a wipe because I was just so scared.
Yeah, it's like whatever you do get on that, it's like, yeah, we're not really supposed to introduce alcohol to the patient's skin, but a lot of the times. Wipe. Okay. Well, I mean.
Soap. Get some soap there.
It's like, get you a wet rag, like soaking wet rag, flop it there, and leave it for a little while, right? It's like if they'll let you, just leave it there. Just make sure it ain't too hot or too cold. But yeah, no, that tape right there is definitely something that you have to worry about. Because, I mean, there's some of these people who are on medicines. They have to be checked. They have to have their blood checked like 3 times a week, if not more. And you'll have tape. So, I mean, just that's one of your considerations whenever you're thinking about them. Okay, so NCLEX review time, y'all. Alright, function of the skins include which of the following? Select all that apply. Temperature regulation, synthesis of vitamin B, production of new cells by melanocytes, secretion of a drying substance called sebum. I say that so wrong every time I say it. Protection. So, what do y'all think?
No, it's probably D. It's A and E.
A and E. Yeah. So actually, whenever I was looking into it, like looking at the responses, one of y'all said vitamin D. That right there is what would have made that one correct. This right here, that was just a random one. All right, this one right here is the one that I feel like could trip some people up. Because while it's not a function of the integumentary system, it is a something that is produced by it. So, all right. So, which of the following are common issues the aging causes on the integumentary system? Select all that apply. Increased fat production. What were you saying? You want me to finish saying?
It's B, C, D, and E. Or no, B, C, and E. I'm sorry.
I can read really fast.
Slow down.
All right. So yes, it is B, C, and E. And it's like this one right here. You're decreasing, thinning. Ms. Lodemeyer, that was correct. All right, which assessment finding is associated with normal aging? The integumentary system loses elasticity. There's loss of muscle tone, which increases the incidence of choking and aspiration. There is a gradual loss of weight because of the loss of muscle tissue and fluid. There is increased resistance to infection from improved immune response. Personality changes are anticipated as the individual approaches 70 years of age.
She said A is correct.
Mm-hmm.
B.
Mm-hmm. Y'all ready?
Yep.
All right, A, B, and C.
A, B, and C.
So it's like you are having a gradual loss of weight because again, it's like dehydration. There's fluid loss going on there. There's muscle tone being lost. It's like, and again, if you're there's muscle tissue being lost and there's muscle tone being lost. This right here, there is a decrease risk, right?
Mm-hmm.
And this right here, the aging doesn't really affect the personality. What is, it's like when I mentioned environmental changes, that might affect the personality. It's like situation changes. Just those are what's going to change the personality. It's not going to be anything to do with age. What are the key risk factors for pressure ulcers in a geriatric patients, and how can these be mitigated? Frequent mobility and sensory perception, reduced subcutaneous fat and mobility, regular hydration and balanced nutrition, increased physical activity and exposure to sunlight. I was about to say this one isn't select all that apply.
Oh, yeah.
What are key risk factors?
A.
So how it's like we're looking at how they can be mitigated. So they have fluid issues and a lot of times nutrition issues. So regular hydration and balanced nutrition. Yeah, it's like a lot of these are risk factors, but we're looking at how they can be mitigated, right? Okay, the nurse is bathing an 80-year-old man and notices that his skin is wrinkled, thin, lax, and dry. This finding would be related to which factor in older adults? Increased vascularity of the skin, increased number of sweat and sebaceous glands, an increase in elastin and a decrease in subcutaneous fat, an increased loss of elastin and a decrease in subcutaneous fat. It is D. It's like they try to trick you a little bit with that word in there, don't they? And it's like this increase right here made you think it was wrong at first, right? Because that's what it did to me. All right. So what is common characteristics of moles in geriatric patients? Moles tend to become smaller and less noticeable with age. Moles often disappear completely as individuals age. Moles in geriatric patients may change in color, size, and shape. Geriatric patients typically develop more moles as they age. C. It's like we're still going to monitor it, right? And we're still going to tell a doctor and do something, but they are likely to change. And that was it.